Hi, I'm Christi Idavoy and I'm an educator at Polestar Pilates. I'd like to share with you today an exercise that I find really helpful from the beginning of my pregnancy and now as I move into my last and third trimester. So we'll use the tower bar sprung with two long medium springs, and you'll want to hold on to the bar as wide as the bar will let you go, and you'll start with a small turnout in your hips. So you want to make sure that when you look down, you can see that your hips, knees, and second toes are in alignment. So if you slightly bend your knees, you'll be able to tell that if that's happening. And if you don't have access to a trapeze table or Pilates apparatus, you can also do this with heavy TheraBands, or there are a lot of walls nowadays with elastic bands, even at gyms, or pulley systems that you could replicate this exercise. So we'll start with our hands as wide as a bar will let us go, or more or less shoulder width apart. You just want to make sure that it feels like your ears, your shoulders, ribs, and hips are stacked on top of each other. And as I exhale, I'm going to bend my knees and allow myself to lean back slightly, trying to keep my heels on the ground while I'm doing this. As I inhale, I'm going to press down through my legs and slightly lean back. It almost feels like I'm hanging off of the bar as I glide up and down. So again, as we're going down, we want to allow the pelvis to descend and feel the opening through the sits bones and the weight evenly distributed through the feet. And on the way up, we want to keep that sense of ease through the pelvis and really think more about pressing the floor away and keeping the alignment of the ears, shoulders, ribs, and hips as best as we can. And then we come up and just simply let go of the bar. So you can do that about 5 or 10 times, whatever feels good. And again, just make sure that you're really thinking about using the least amount of muscle effort, only what's necessary, just more in tune with your alignment and where you are in space. Hope that helps.